Hey guys, I'm Tanish and I'm on farm today. I'm just going to walk you through how to conduct the roll today. So the first thing you need to do to get started with your farm roll is to set up everything that you need for farm. There's a couple important things that you need to get set up. The first is the farm laptop. Everything essentially that you need to set up is going to be found in this cabinet, which is our pharmacy cabinet. Your farm laptop is going to be found right here, and you can grab it from here in one of these black boxes. The next thing that you need is these transparent white boxes. These will have some of the important materials that you need to conduct your farm. You also need to actually grab the bottles that you need to dispense medications, which will likely be found underneath here, right here, in a bag like this or in the box right here. From the transparent boxes, you want to grab these plastic devices. These are the pill counters that you need to count the pills once you dispense them. You also want to make sure that you have alcohol prep pads to clean the pill counters when you're dispensing your medication. Within the bottom compartment of the transparent boxes, you're also going to find these long pieces of paper. These are the pharmacy labels that you need to attach to these bottles once you're dispensing medication. We'll talk more about these in a bit. And that's pretty much it that you need to get started with the farm roll. We'll be covering more details about the computer softwares that you need to launch in a bit.
So now that you've gotten everything out of the farm cabinet or the farm shift, there's a couple of key programs you need to log into for the farm shift. All of the accounts for all of the programs that we're going to be talking about are listed on a sticky note on the bottom right hand side of the farm computer. Let's get started with the first program. The first program is Practice Fusion, which is used so that the med students can send you the order for the medication. Please note that the pharmacy account is different than your personal Practice Fusion account, and the account details for the pharmacy Practice Fusion account are found on the sticky note. Let's get logged in. Now we've logged into Practice Fusion. Please keep in mind that the first time that you log into Practice Fusion for each farm shift, there will be a two-step verification process where Practice Fusion will send a security code to a number that the managers have access to. As such, let the managers know that you're trying to sign into the Practice Fusion account for pharmacy, and they will be able to give you the code. The second program that you want to log into is your own personal Gmail account. Normally, before every shift, the pharmacy heads will send you an email describing tons of important information for the upcoming pharmacy shift. This can include things like audit information, protocols, account details, etc. To access this, log into your personal UC Davis Gmail account on the farm computer. The third important program that we want to log into is Computer RX. This is the inventory software that is used to keep track of all our medications at Willow. The icon for this is a blue circle with the RX logo listed here, as seen here. The account details for this are also listed on the blue sticky note. Let's get logged in.
Login successful.
Alright, now you've launched all the programs that you need to get set up with the farm shift. Another important part of setting up for the farm shift is creating the labels folder for the day and printing out the inventory report so that our preceptors and med students know what medications we have on stock. To generate the labels folder for the day, click on this folder icon here, go up to Labels, and look for the yearly labels folder. Click on that and scroll all the way down. Then click on this new folder icon and create a folder with today's date, as seen over here. Have this ready for when labels will be generated once medication orders start coming in. To print out the inventory report for the day, access Computer RX and click on Reports. From there, click on Drug Reports and Drug List. Computer RX will now start to make a report of all the medications that we have on stock. From here, connect the printer to the pharmacy laptop using the USB cable and click print. The printer that we normally use is the Brother HL computer. Click print and the inventory report should start printing out. Now that you've set everything up for the farm shift, let's learn a little bit more about dispensing medications. There's a couple of important steps that need to be completed in order to properly dispense medications. The first step is to receive the medication order from the med students via the Willow Pharmacy Practice Fusion account. As such, when a med student tells you that they've sent a medication order, first go to the Practice Fusion account, click on Messages, and you'll see this screen right here. This screen has all the messages from all the clinics past, so find the appropriate order by comparing the patient's name and the med student's name. Click on it, and the note will expand with a lot of important information that will be needed to prescribe the medications. A proper medication order should have the drug's name, the dosage, the frequency, and other titrating instructions such as the amount to be prescribed and the duration of treatment. If there are abbreviations that you are not familiar with, please ask the med student. A proper medication order should also have the route of the medication. This refers to how the patient will take the medication. For example, by mouth for a tablet or by skin application for something like a skin patch. Once you have this medication order, go to Computer RX and click on New F9. A form will open up requiring some of the information that we talked about before. The first piece of information is the patient's name. As you see, Computer RX now checks the database of previous patients who have received medication from Willow and compares it to what you entered before. If it finds some patient with a matching name, the name will show up over here. However, if the name does not show up, click Add F10 and enter the patient's name and birth date, and you should be good to go. Here, the patient did show up, so we can just press OK. Once that is done, input the drug that needs to be dispensed, and make sure to check that the proper dosage is selected. Here we're prescribing 20 milligrams, so we click on that and then we press OK. Now, the med student mentioned that we need to dispense out 30 tablets, so 30 tablets right here. Now, based on the medication order med student sent, we can collect all the necessary information for the directions that the patient should follow. Here, QD means take every day. So, we can go back to Computer RX, type. Here, I also added the route since lisinopril 20 milligrams is a tablet. Day supply is where a little bit of math is needed. This refers to how many days the patient should be taking this medication for. Here, the patient is taking 1 tablet per day, and we're prescribing a total of 30 tablets. So the patient will be taking the medication for 30 days. However, for example, if the patient was to take 2 tablets and we were dispensing 30 tablets, the day supply would be 15 days. Under doctor, fill in the name of the preceptor for the day. From there, filled by, input in your initials and hit F12. If a pop-up opens asking for drug interactions, you can just put in not applicable and the program should allow you to dispense out the medications. Once the program is blank, that means that the medication order has gone through to the prescription queue and you are good to move on to the next step.
Alright, now that you've put everything into Computer RX, it's time to actually dispense out the medications. To do so, walk over to the farm cabinet and grab the appropriate medication. The farm cabinet is organized alphabetically and with all the dosage listed next to the names of the medications. Since we're dispensing lisinopril today, go over to the L's and look for the 20 milligram bottle. Grab it and make sure that what you grabbed is actually lisinopril 20 milligrams by looking at the name and the NDC. Also, if there's multiple bottles of the same medication, grab the one with the X on top, since that means that the bottle has been used previously, and we want to grab that so that we don't waste medications by breaking open the cover before we need to. If the medication that you are pulling out is new and doesn't have its cover broken, use it, but then make sure to put that X on top so that other volunteers know. Once you have ensured that the medication is correct, walk over to the farm station, grab a pair of gloves, and use an alcohol prep pad to clean the pill counters that you've used previously. Dispense out the medication and count the appropriate amount using this tool here. Any extras that you'd grabbed can be put back into the bottle with this section of the pill counter. Now, use this section of the pill counter to fill up the bottle and close the lid. Grab another alcohol prep pad, tear it open, and clean the pill counter. Another key note is when grabbing the pill counters, make sure that the pill counter that you're grabbing is not the Cillin only pill counter. That is a pill counter that is used exclusively for medications ending in Cillin, such as penicillin, since some people are allergic to those and we don't want to cross-contaminate medications.
Now that you've inputted everything into Computer RX, generated the label, and dispensed out the medication into the vial, let's learn a little bit about actually printing the labels that will be going on to the medication bottle. The first step for this process is to go to this screen on Computer RX, then click on Q and click on RX status. Here you'll see all the medication labels that are generated for a particular period of time. Here we're looking at the time from 4:15 to 4:18. Normally in clinic dates, if you just change this dates to the date of the clinic, that would make it easier. From here, click on the medication label, then click export. Then go to the labels folder and look for the labels folder that you had created earlier in the day. Click on it and save the patient's label using their last name and their first name, with the last name coming first. If a patient has multiple medications, make sure to save all of these individually by clicking on each medication. Hit save, and you are good to go once this message shows up. From here, to actually go about printing the labels, attach the cable that is shared between pharmacy and data for the printer to the farm laptop. Then double click on this patient's name here and click print label once you're ready to print the label using the method that we'll be going over shortly.
Alright, now that you have dispensed your medications in your bottle and have inputted everything into Computer RX, it's time to print the label. To do so, take the label paper from the bottom cabinet of the transparent cabinet right here and put it in the front compartment of the printer. This is how a printed label paper looks like. There's three important components to keep track of. This component right here, this is component 1. These little tabs here, that's number 2, and the larger sheet with the information, that's number 3. Stick number 1 and 2 onto the medication label. If a couple of the tabs are blank, that's fine. Don't have them there, and then you're fine. Make sure they're all good. Now, once you have all of this ready, take everything over to the preceptor, including the medication vial, to get checked. Hello, can you just check this out, please?
Sounds good.
All right, perfect. Could you just sign on section 1 there, please?
Section 1? Okay.
All right, perfect. Thank you so much. Then, once you have the signature, rip out section 3, fold it up, put it into a brown paper bag. These can be found also in the transparent cabinets there or the black cabinet on the top over there.
Now that you've come to the end of your farm shift, there's a couple of key protocols that need to be followed in order to properly wrap up the clinic. The first of this protocol is to generate 2 reports. The first of these reports is called the dispensing report, which is basically a list of all the medications that have been dispensed for a particular period. To generate this report, go to Report, Dispensing Report, and click Detailed Dispensing Report for period. From there, click on the date of the clinic in both fields and hit Enter. Once this menu pops up, highlight it and click Export. Make sure to highlight all the drugs that were dispensed for that particular clinic. Once this window pops up, scroll up, click on Dispensing Reports, and save the dispensing report under this day like so. Hit Save and you're good to go. To generate the second report, which is known as the inventory report, go to Reports, Drug Report, and Drug List. Once Computer RX makes this whole list, click Export, scroll up, go to Inventory Report, and save this report under the date of the clinic as seen here. Now that those reports have been generated, log on to your personal email account and look for the weekly farm email that you should have received before the start of your farm shift. In that email, you'll find a Google Doc with that clinic date's particular date. Open that up and fill in all the appropriate fields, such as your name, any audits that have been assigned for that date, any medications that you felt were running low, and other such things. Once that is done, go back and reply to this email. Make sure to tell us that you have filled in the Google Doc for the date and attach the 2 reports that you just generated. When attaching these reports, you'll see that 2 files have been generated for a given report, one as the comma-separated value and one as the worksheet file. Please make sure to attach the worksheet file. Once that is all done, you're all good to go. Hit send and we'll receive all the updates for that doc. Thank you so much for serving on the farm shift. Now let's go over some of the common issues that might arise on the pharmacy shift. One of the most common issues is something going wrong with the initial label printing process. In this situation, to print the label again, go back to the home page on Computer RX, click on Q, go to RX status, double click in on the patient's name again, and once this menu opens up, hit print label, OK, and no. Once you've done this, connect the farm laptop to the printer using the USB cable again, load the label paper in the appropriate manner, and the label should be printed out correctly.
Now, one common error that can happen on the farm shift is dropping a pill. Say you're counting something and you happen to drop a pill. That is totally fine. That happens, but it's important to go through the proper protocol to make sure that the on-hand amounts are properly adjusted for. If you do drop a pill, first thing to do is grab the dropped pill container from the pharmacy cabinet, put on a pair of gloves, and put the pill in the dropped pill container. Then it's important to update the on-hand amount on Computer RX, which we'll be going over in the screen recording.
Alright, now that you've put the dropped pill into the dropped pill container, let's go over how to change the on-hand amount on Computer RX so that the amount that we expect is the same as that we actually have. To do so, go to Drug and enter in the name of the drug that you dropped. Let's say we dropped lisinopril 20 milligrams. Here, once this menu opens up, go to Inventory and change this number here, on hand. Change it by however many pills that you dropped. Say we dropped 1 pill. We change the number from 56 to 55, hit save, and then for the reason, we can put in and the date. Alright, now even though you happen to drop a pill, you've made all proper protocols to ensure that this does not hamper clinic flow in any way.